primary goal with rectal cancer is to cure our patients. We want to ensure that you have the best chance of being alive and well and cancer-free down the road.
So I remember the day of my first radiation treatment, coming in to the building and meeting the radiation therapists and discussing what they were going to do.
Once you've decided on a radiation treatment, patients have to have a simulation appointment.
The objective was to mark me with permanent tattoo dots. You drop your drawers, you're put on a table, you're lined up. The objective is to put 3 little dots, 2 on your hips and 1 at the top of your tailbone. It's to ensure that you are lined up exactly properly to have your radiation treatments and doesn't affect any other parts that you don't want to have zapped with radiation.
During the simulation, one of the things that we are doing is having patients treated with a full bladder. The bladder pushes upward and pushes the small bowel out of the way of the radiation treatment, minimizing major radiation side effects during the treatment and afterwards.
Most likely you can expect that you will have some challenges with the rapidly dividing cell areas in your body, those being the palms of your hands, the bottoms of your feet, and potentially the inside of your mouth.
Typically the process for treatment is about 30 to 40 seconds per treatment field. Not like 15 or 20 minutes of radiation that a lot of people think it is. A lot of people think they're radioactive. They're not. Explain to them all those details and reassure them that the treatment is safe. It's very accurate. With the imaging systems we have nowadays, we're looking at an accuracy of less than roughly 3 millimeters. The treatment machines are designed with patient safety in mind at all times.
I could see that, yeah, what they're doing is going to ensure that I only get this treatment where I need to get the treatment. So I'm lying with my pants around my ankles and my butt up in the air, a little embarrassed maybe the first time, and just let them do their work. And it went by very quickly. You know, it's absolutely not invasive.
Each day of radiation treatment is like getting an x-ray done. You can drive yourself to your appointment, have your treatment, and drive yourself home. The radiation, you feel nothing, you see nothing. It's like getting an x-ray done.
I remember showing up and picking up my first dose of chemotherapy pills, and it's a great big pile of pills. I was taking 5 pills twice a day.
So once you're on radiation chemotherapy, you're going to be evaluated on a daily basis by a radiation therapist team.
Chemotherapy was uncertainty and just taking it day by day. The reactions that I had to the pills that I took were absolutely as predicted. The reactions for me were soreness, redness in my palms of my hands and the bottom of my feet.
Therapists will evaluate patients, and if they notice that there are any problems or issues arising, patients will often meet with a nurse who will perform a more detailed assessment. We want to weigh you, perform a set of vitals to make sure that you are well.
I think there were maybe 6 weeks of radiation and 5 weeks of pills.
Weekly blood work is also performed as part of this investigations. You will then meet with your cancer specialist, your radiation oncologist, and your medical oncologist, typically on a weekly basis.
Chemotherapy was over, radiation was over, job well done. Next step was 6 weeks of recovery and getting ready for surgery. Surgery is always a scary thing, and this is a big surgery. I'd never had a surgery before, so I was apprehensive. But there's nothing you can do. You got to go in there and do it. It's a 3-hour surgery. Then you go into recovery. It's amazing how many people there are that are dealing with this or something else like it. So I'm not alone. I'm not alone from a patient perspective, and I'm not alone from a doctor perspective.